Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello everyone, I'm Dr. Radhika Sonat, ENT and an allergy specialist. I'm an assistant honorary surgeon working at SAIT AJB Municipal ENT Hospital, Mumbai. I'm here to brief you all on a topic that's vertigo. Vertigo is one of the most commonly misunderstood symptoms that most patients bring to an ENT clinic. Many people describe vertigo as dizziness, but actually, it is a specific sensation of a moment where a patient often feels that the room around them is spinning and rotating, or they are feeling imbalanced when they are walking around, but actually when they are perfectly still. As an ENT surgeon, I frequently explain this to patients what is a sense of balance. It's a complex partnership between our inner ear, the eyes, and the brain. They work in great unison to keep our body in balance. For ENT surgeons, the delicate balance system, which belongs to the inner ear, is the vestibular system, which frequently sends information to the brain about our head position and movement. When this system is disrupted, vertigo can occur. One of the most common causes of vertigo in ENT is benign paroxysmal positional vertigo. With tiny calcium particles which run in the fluid canals in the inner ear, they become displaced and trigger the system, which causes brief episodes of spinning sensation or rotatory movements of the surroundings, especially when turning in bed, looking up, and bending down, particularly with change in the head posture. While this might sound alarming, it is usually treatable. The simple repositioning maneuvers performed by ENT surgeons is sufficient. Other causes include vestibular neuritis, which is the inflammation of the balance nerve. There's Meniere's disease, which is associated with vertigo, hearing loss, and ringing in the ears, that's called tinnitus. And there's migraine, which has also become a very common cause of vertigo these days. And then there are associated neurological conditions. This is why a detailed history and examination is very important in determining what is the cause of the underlying vertigo. Many patients think that vertigo is a disease in itself, but it's actually a symptom. The key lies in understanding why it is occurring. So during an evaluation, we look into the duration of symptoms, the associated hearing changes, the triggers, and any other accompanying neurological signs which help guide our diagnosis and treatment. So treatment depends on the cause. So that's why a detailed history becomes at most important. Some forms of vertigo respond very well to specific physical maneuvers, while few require certain medications. Then there is vestibular rehabilitation therapy, dietary modification, and treatment of the underlying condition when it comes to neurology. Importantly, anyone who's experiencing sudden severe vertigo accompanied by weakness, difficulty in speaking, double vision, or facial drooping, I advise them to seek immediate medical attention as this might indicate some neurological emergency. The reassuring news is that most causes of vertigo are manageable, and many patients experience significant improvement once we make the correct diagnosis. The first step in understanding that vertigo is not something to ignore, but it is also not something that you should be afraid of. With proper evaluation and treatment, most people return to their normal daily activities and regain confidence in their balance. For listeners experiencing recurrent dizziness or vertigo, my advice is simple. Do not self-diagnose. Seek a professional evaluation because the right diagnosis is the foundation of an effective treatment.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.